Morning, everybody, and thank you so very much for joining us on this beautiful Friday morning to hear Jason Helling's presentation. Jason is an executive for Health Partners Patient Experience, and he'll be presenting on the program today and some of the program highlights. So, Jason, without further ado, I will pass it along to you. Thank you for
Well,
being here.
yeah, thank you, Abby. I appreciate the invitation and really excited to share some of the work that we're doing across Health Partners with regard to Health Partners experience. So I'll kick it off. I want to share a little bit about our team. So we actually serve Methodist, Park Nicollet, and all of Health Partners on the care delivery side. So that's something relatively new over the last couple of years where we're really trying to work as one care group system. And how it looks, and actually, you know what, before I get started, I jumped right in here. I should tell you a little bit about myself too. So I have responsibilities for experience results across the care delivery piece of Health Partners. So I think most of you are aware that we have an insurance plan side, we have a research side, and then also the care side. And so my team and I are responsible for the results of our experience across all 8 hospitals, across Health Partners, Park Nicollet, and then the clinics, the surgery centers, the EDs, anywhere where we're delivering care. A little bit about me, I'm actually a physical therapist by clinical background, but I've been working in the experience world for about 8 or 9 years now. And I came from Fairview, so I've spent most of my career at Fairview, but I've been with Health Partners for about 5.5 years now. I started as the director of hospital experience for Regions and Methodist hospitals. And then about 2.5 years ago is when my role was expanded to include all of the care delivery side. So I'll kind of cover that background for you so you have an idea of who I am. And this is my team. So we, as I said, work across the system. I have 2 dyad partners, so 2 physician partners who work with me. Some of you may know Dr. Nima Desai. She is the Vice President of Medical Affairs at Methodist Hospital as well. And then Dr. Annie Eideker as well is a partner of mine. I have 4 team members who work directly with me, and then you can see the rest of our team works across the system. So both in Stillwater and Western Wisconsin, and then in our central Minnesota hospitals of Olivia and Hutchinson. A little bit about what we do. You'll hear a lot of us talking about hearing and acting on our patient voices. So a lot of that is through our patient survey process. I would bet most of you have received some form of a survey from us. We deliver them after you've had a care experience, either in our hospitals or our clinics or emergency departments. And across our system, we actually receive almost 500,000 surveys in a year. And from that, we act on that data to guide our teams on how we can better provide an exceptional experience. We also have patient and family advisory groups in each of our hospitals, and then also we have a broader Health Partners Experience Council too, or Advisory Council. Some of you are members of our Methodist Council. It's a really strong and active group. Occasionally, we will pull together focus groups. If there's a specific topic, either on a quality, experience, or safety issue, we'll pull in specific patient members who maybe have experience in that area to receive some specific patient feedback. We're involved in quality and safety work in addition to experience work. And then hopefully what you'll see today is that there is a little method to our madness, and that we take the data and the comments that we receive from our patients to help our teams improve the service they're delivering. So to kick us off here, the data and the survey is kind of the boring piece of it. This is how we receive our information. In the hospital setting, we use this acronym called HCAHPS, and we do that because the full name of it is the Hospital Consumer Assessment of Healthcare Providers and Systems, which is a mouthful. So we typically will say HCAHPS. It is currently a paper survey. It's going to be transitioning to an emailed survey next year, but it is a mandated survey from our colleagues at Medicare. So CMS is an acronym for Medicare, and all hospitals across the United States deliver the same survey. So it's a way for us to be able to compare apples to apples across the US, and regardless of size too. So The Methodist survey is the same as the one that we deliver in Hutchinson, which is the same as the one we deliver in Amory, Wisconsin. So it's a way for us to compare every hospital in the same fashion. The survey is delivered randomly, so not every single patient receives this survey from us. It is a random selection. It's only for adults, and it is not restricted just to Medicare patients. So that's something that is a little bit of a myth out there. Actually, regardless of payer, doesn't matter what the payer is, even though Medicare reports those results, if you had commercial insurance, you would receive the same survey. Now, if you aren't selected for that survey, something special that we do at Regions and Methodists in particular for our inpatients, and then actually across all of our care sites, so all of the clinics, the emergency departments, urgent care, doesn't matter, we deliver what's called a real-time survey. That name is a little bit of a misnomer because it isn't truly real-time. It's after you've experienced care with us. So about 48 hours, sometimes 24, depending on your setting. If you aren't selected as an inpatient for that paper survey, you would get a text from us. And it's a much shorter survey. So something I didn't mention with that paper survey, it's really long. It's like 30 to 40 questions. This survey that we deliver via text is just 10 to 12. And we do that so that it isn't so overwhelming to try to answer those questions. But the other reason why we do this is that we get feedback really quickly from this survey. Whereas if you are an inpatient, receive that other survey, you won't get it until 1 to 2 weeks after you've been discharged. And then we're dependent on when you decide to fill it out and mail it back in. We actually do have a pretty strong response rate with that paper survey. So about 25% of our patients do return it. However, with this real-time survey, our response rate is a little bit stronger. So it's a little over 30%. And we get the feedback right away. So we get it the very next day. So if you have a concern or a complaint or a compliment, we're able to act on it right away for our teams. It also gives us a greater volume of feedback because probably 3 to 4 times more patients answer this real-time survey than they do the HCAP survey. So it's just another way for us to receive some information. Now, why do we do this? Why is this important? It's because it's a competitive market out there. I think we are very fortunate to live in the Twin Cities where we have a lot of healthcare opportunities. It's very easy to go down the street and see a different healthcare system. And we all provide exceptional care. And that's something that's really nice and unique in Minnesota. But what separates us is the experience. So it's how we make you feel. The quality of care is exceptional in Minnesota. We're very fortunate for that. But if we have a better connection with you as a patient or a family member, you're more likely to return to us rather than to try out a different healthcare system. And so our brand really reflects who we are as people who come to work here every day. And that's part of what the work that we're doing. We do that because we've really transitioned in healthcare over the last few years. So other industries, this is just an example of some quotes from other industries. They've been doing this work for a really long time. I think what's transitioning in healthcare is that people are starting to pay more out of pocket for their healthcare, and that makes them pay attention a little bit more to the experience that they're having. We hear this from our patients every single day. I know some members of my team are on this call, and I don't think any of these quotes will be unusual for any of you outside of our experience team. You probably hear this from your friends, from your family members, that I'm paying a lot for this, and if I'm not getting the experience I want, I'm going to go somewhere else. And this is expensive now. My copay is higher than it used to be. And I want to make sure that I've had a great interaction with the person providing care for me. It's also complicated. So I think there are many times those of us in the industry say, thank goodness we know the industry because it's so hard to navigate. And how can we make it more simple and affordable for our patients and members? And finally, it's that trust factor. It's that I need to trust who I'm working with, and I need that person to be a partner with me because I don't understand the system and I'm sick, I don't feel very well. I need someone to help guide me so that I can take the correct next steps in my care journey as well. And that's led us to the work I'm really going to focus on for today, which is the Health Partners experience. And I wanted to give a little example of uh, a little background for why we're doing this work. For one, it's in our name as a broad organization of health partners, and we want to be a partner for good. We want that to be your experience every time you experience care with us. We want to make sure that we're delivering an experience that's differentiated. So if you come to Park Nicollet, you know that your experience is going to be great every single time. And why do we need to do that? As I referenced before, our competition in Minnesota is really tough. Everybody provides exceptional care. And for us to make sure that we're meeting and exceeding our business goals to grow and to have best outcomes, we need to be consistent with the way that we are approaching every single interaction. And so something that we strive as a culture here is we make sure that every single colleague knows their role is important, I should say, in that every single interaction eventually leads back to a patient. I could even be sitting at home doing billing, but that billing has a huge impact on how I'm experiencing care after the fact, right? So lots of times we can have a great experience, and then if we have concerns with our bill, it clouds the whole interaction that we've had prior to that. So what we're really focusing on is making sure everybody in our organization understands how important their role is, not only serving our patients and our families, but also one another, because we're all humans and we all have those same needs. And I'm going to talk about that in just a second. When we were looking at our patient feedback, I hope this is not surprising, but these were the themes that came out. Communication is of the utmost importance. Not only that it's respectful and courteous, but we're also consistent, because if you're receiving inconsistent messages, especially if you're an inpatient with us, that's a really vulnerable time for our patients and families, because you're not feeling well, you're unsure about your health, and if you're receiving inconsistent messages, that just tends to erode our trust. We speak in acronyms all the time. I did it at the top of this presentation with our HCAHPS survey, for instance, and using CMS for Medicare. That can really be disconcerting for patients if we're talking in a language that they don't understand. And let's be frank, medical language is its own language. And, and it's very confusing for those of you that aren't in it every single day. So how do we explain things in a way that is understood to help ease some of that anxiety and once again build that trust? The next thing is I want to be known as my own person. I want people to know Jason and what I need as an individual, not just as a group of a whole population. So knowing our patients and really hearing about what is needed from me as an individual, you as a family member, and then treating that patient as a person rather than a diagnosis. I think some of the past healthcare approaches has been treating a heart attack. You know, we talk about the heart attack in room 57. That isn't the heart attack. It is Shannon in room 57. And Shannon needs this, and these are her family members, and this is her plan of care. So it's really making sure that people feel like they are important as their own person. And all of that builds trust. So I frequently fall back to comments that I hear from my own family, from friends. They'll go see a physician or have some kind of care experience, and you ask them if they're going to follow through on what was suggested for them. Sometimes that response is, "Oh no, I'm not going to do that," because they don't know what they're talking about. Well, I think we can all agree that in most cases, the care provider does know what they're talking about. But what has happened there is they haven't built the rapport and built that trust with your family member or my family member. And because of that, they're not going to follow through. And I think we see that on an individual basis as well. Trust is the foundation for almost every single relationship. And so all of this work is really geared towards how do we build trusting relationships. And that's how we landed on the Health Partners experience that I'm going to really talk about now. It's feeling seen, it's feeling known, it's feeling heard. And when we do those foundational elements, we can partner with you. And you'll see here that I said it's a human-centered approach to evolving our culture. And what I mean by that is that it isn't purely centered on our patients, because everybody, every human that walks through our doors or calls us on the phone or accesses us on our website is a human. And they want to know that we're seeing them, knowing them, and hearing them. And I say evolving our culture because I don't mean to imply that our culture was poor. At Park Nicollet and Health Partners, we actually have a really, really strong culture, but this is just tweaking it and recentering people on what we're expecting with every interaction. Now, the work of my team, once again, is to take that feedback that we get and to inform our teams and choose the biggest levers so that we can have the biggest impact in improving your experience. So we do that by the surveys that I referenced at the top. With that, we get a lot of comments that are really, really important, and most of them are really positive. There are times when there is constructive criticism in those comments, and we use those as themes to go back to our teams and help them improve. If we just stay admiring our data, just talking about our comments, and we don't actually make any changes in your actual experience, those results will just remain the same. And so that's where we're trying to improve by working upstream, by making sure that we're using the information we're getting to improve. Now, what we found with HP experience, that these are really the foundational elements. And it goes back to that earlier slide I had, which is really, we want to feel cared about as a person when we are accessing care. We want to receive consistent information. We want to know that we've been heard. And when we do all of that, we've built that trust so that we can work together as partners. When you frame it up as how are we doing this as an organization, I think most of you are aware that our values are compassion, partnership, excellence, and integrity. Now, that's who we are as an organization. Uh, that's our inner being. But the actions are what I'm going to talk about, which is feeling seen, feeling known, feeling heard. And then when we do all that, we're actually a partner for good. Now, the Partner for Good piece came from a marketing campaign. And I'd like to say that we were working together on that. We actually were not. But what was interesting about it is that when we peered over the fence at each other's work, it completely aligned because we're trying to achieve partnership on the experience side. And we were using Health Partners to be your partner for good as a marketing slogan. And they actually married together perfectly. So how do we carry that out as actions? So this is a really busy slide with a lot of information on it. I'm not going to cover all of this, but I want you to see that it's really basic things. We didn't change any of the work that we were doing. We just realigned it so that for our team that comes to work every day, we're not throwing something new at them. We're not giving them any new and shiny object to improve experience, because really the basics of it is that human interaction. It's how we relate to one another. It's how we deliver information and how we partner with you on what's next in your care journey. So what was interesting as well, our outcome that we're seeking with this work is to improve trust. When you look at the Health Partners vision statement, it's relationships built on trust. So we've had it all along. Now there's just a concerted effort on how do we continue to build this trust. And our goal with all this work is aspirational. I'll share results here in a little bit. We're doing quite well. I think Methodists in particular can be really proud of the experience results that we receive. Our goal is to be in the top decile nationally. And how we compare that is with that survey that I talked about. All hospitals across the US have that same survey. So we're currently in the top quartile nationally. Our goal is to be in the top 10%. So we have a little bit to go, but we're not far off. And that's something to be really proud of, I think. All of this really builds to culture. So you can say that our work that my team and I do is experience focused. However, it's really about building culture, and it's how we show up every day. And this is our goal. Our goal is that we treat each other how we would want to be treated, how you want to be treated, that we shouldn't be surprised. I think we're still at a point in our culture where we're pleasantly surprised when a patient says that we've met all of these elements and they've had a great experience. We want that to be the norm and that we're more surprised when it doesn't occur. And we want to try to make today a little better than yesterday. We're a really big organization, and moving the dial on an organization with 27,000 overall staff members takes a while. But incrementally, we're getting there. And we want everyone to know that their role is important. Every person in this, I often say my team is on this, and they've heard this a million times, that nobody works in isolation in healthcare. Even in a clinic, you never walk into a clinic and only see the clinician in front of you. You are greeted at the desk. Someone takes you back, a nurse or a CMA brings you back into the room, and then the clinician comes in and works with you. Then you may go see lab. You may have some imaging done. You have to make another appointment. There is never one healthcare interaction that only involves one role. And so all of those roles are really critical to making sure that we're successful. Just to share a little bit with you where we have been and where we're going with this work too. So this has been going on for years, actually. I've been working on it for probably about 4 years. It is becoming broader and broader in the knowledge of all of our staff members across HealthPartners, but we worked a lot last year to make sure we had all of our ducks in a row and to make sure all of our stakeholders were engaged. So this is a full court press with our culture change. HR is involved, marketing is involved, communications. You'll see in a moment I have a strong partner in communications. It's all the major stakeholders coming together to give feedback in how we do this and how we sustain it. So this year we've done a lot of work to get the messaging out, and next year we're going to have more succinct expectations on how we approach every human interaction. But to give you an idea of the scope of what we've been doing, this is our communications roadmap. If you logged on to our internal intranet, I would challenge you to not see the partner for HealthPartners experience communication work out there. Almost every single story, everything we have out there is connected back to feeling seen, feeling known, feeling heard. And it's very intentional to make sure that everybody understands how all of this work connects. My own team works really hard to drive those connections, and we bring stakeholders along so people help create this work. We don't just say, this is what you're going to do. We say, here are the parameters, help us design this. And with that, we make intentional connections to, if we communicate better, our safety is actually going to improve. Our quality is going to improve. We'll be living our mission and vision every single day. So there's benefits for everyone when we are consistent with all of these elements. This is a little bit of the nitty-gritty, but it shows you in particular, we have experience plans across all of our nursing units, for instance. They're visible, so everybody can see them. They're consistent, so they're laid out the same. And they're all aligned. You can see maybe the partner with me highlighted there. So any type of work can relate back to our culture and how we're trying to improve it with these elements. And I want to share how we're doing because it's really positive and fun. So this is a long period of time, so it isn't quite as dramatic as I think it is because I live in this every day. But that dotted line is our target, and that is the 75th percentile for national results. We have been exceeding that at Methodist Hospital consistently over this last year. We weren't far off before, but what's really fun is that we are in the top quartile nationally, and for a metro hospital, the size of Methodist, that's really something to say. Because I'll remind you again that we're compared to all the small rural hospitals as well. And not to take anything away from them because they provide exceptional care as well. but it's a little more challenging when you have so many more professionals involved in your care. That communication is really more difficult. And to see these results is really, really encouraging. The other thing is we are improving trust. So we ask a trust question in all of our surveys to see how we're doing, knowing that if we build trust with you, you'll want to come back to us. And, it goes up and down. There's normal variation here, but I think you can see if I drew a line, it's going up. And that's really, really positive and speaks to the culture that we've been trying to evolve. Finally, this is really fun. So our vendor is NRC Health. So we don't actually send the surveys out ourselves. We use a third-party vendor, and that's required for all organizations to do. NRC Health is ours, and they actually chose Methodist Hospital this past year as the best large hospital in the United States for our results. And you can see you have to have over 350 beds, and there were 88 other eligible facilities, and we came out number one, which is pretty fun and great to celebrate. We also celebrate on our unit level. So on this, I have actually a Regions unit and a Methodist unit, just to show that we're doing the same thing at both hospitals. That little narrative there was a director at Regions who put this out on LinkedIn because she's so proud of her team for achieving the top quartile. That's who receives these banners. We proudly display them on each of our units. When we started this work about 3 years ago, we had 2 units total at both hospitals in the top quartile. Now at Methodist alone, we have 8, and we have 5 at Regions. So we have 13 units currently being recognized for their top experience results, which I think really is a credit to the work that those teams have done to improve their experience for their patients and families. The other thing I like to highlight is that our patients in their comments use the same language. And that is really inspirational to me and makes me feel like we are on the right path. Because when we knock it out of the park for our patients and families, they talk about feeling seen. They talk about feeling known. They talk about feeling heard. And my absolute favorite comment is on the far right corner, bottom corner, where this individual said, "I love having a partner keeping me vertical and functional since I seem to have outlived the warranty." So patients have some unique ways of saying, describing their experience, but they're using this language, and our patients don't have any idea that this is the work that we're doing. So really, really fun. What's next for us? I mentioned our intranet. So that is our web that is only accessed through HealthPartners or Park Nicollet employees. We have a really robust website now for HealthPartners Experience, where there are tools, there are stories, there are dashboards for all of our teams to be able to use with their own teams so that they can help build this momentum that we're seeing. And we're also bringing it to life. As I said, it's really, really hard to get away from HealthPartners Experience each day if you come to work here. So we have stories out there almost every week for sure, but at least most days you can see a story out there. We have videos of, those are the 2 upper right individuals have told stories about how they see patients, how they know patients. We use it in all of our communications. So our presidents every week put out a newsletter. Every week there's something about our culture building work. Those little tiles down at the bottom, the colorful tiles, are a way that we can recognize one another. So colleague to colleague. And then had a great experience with our marketing team, and they branded all of these stories to help people that aren't living this every single day to see that connection. So they can read a story, and because that tag is on there, you can see it on the upper right story there. That's a story about See Me. And so it just helps reinforce that messaging for us. So we're really excited about where this is going. I hope you find this as exciting as I do. Because our main goal is that our patients and our families are the ones that are the end result that have an exceptional experience with us. So that's it for my presentation. And I think now I'm going to turn it back to Abby, and there might be some questions or comments along the way, so I'm happy to address those too.
Jason, thank you so very much for such an excellent presentation. At least speaking for myself, working for Nicollet and Health Partners overall, it makes me very proud to work for this organization with all the amazing work that you guys and your team are doing, just to have that really human-centered approach, and also just acknowledging the fact that all of our coworkers, no matter if you're a clinician or a non-clinician or what have a part in that patient experience. So thank you so much
Yeah,
for taking the
absolutely.
time. Yeah. So for those on the call, if you would like to ask a question, if you could just type it into the chat or the Q&A, I will read it out for Jason. One of the first questions I have for you while I'm looking at the inbox of Q&A and chat is, Jason, just out of curiosity, what makes you passionate about working in health, in patient experience specifically?
Yeah, I mentioned at the top that I'm actually a physical therapist, and when I set out on my career, I never anticipated not being treating patients. But as I was treating patients, I realized the importance and the value of just really making sure my patients understood that I was with them in this game, that I was their partner, that I wanted them to get better and we were going to work together. And in order for me to be successful as a clinician, I really needed to listen. I really needed to know who I was working with and really provide that individual care. And it just really, I always raised my hand when there were opportunities to improve experience and never ever anticipated that this would be my career. And I'm energized every day to see people walking away, not only receiving exceptional care, but really feeling like they have been seen as an individual and that they uh, feel like they're cared about as a person. And that I think that drives me every day. It drives our team every day, and it really drives our caregivers every day too.
Thank you. That's
Yeah.
awesome. I do have a question to ask you. Jeff had asked, as a volunteer manning an information desk, I'm occasionally asked by a patient, where are the ovation forms? I want to highlight a great experience. This feedback method seems to have been phased out, question mark. Could you speak
Hmm.
to the ovation forms?
So those ovation forms are internal, so they are colleague to colleague, but we should
Okay.
have, yeah, we should have forms out there in boxes. I appreciate you bringing this forward, Jeff, because it hasn't gone away. We should have recognition forms out there where patients can actually write their feedback and drop it off. So I'll need to check on that if they're not out there. We have them across the system.
Thank you, and thank you, Jeff. Let's see if we have any other questions. Let's see here. Perfect. Well, Jason, if anybody has any questions after this presentation, is it okay with you if I field them over to you and everything like that?
Absolutely. Yeah.
Okay. Awesome. Well, thank you again for the amazing work. And I'm sorry, one moment before I close out. It looks like we have another one. Another question, excuse me. Steve asked, I am a patient volunteer with a background in patient communications and patient experience. How can I become involved in this activity?
So reach out to me. And one way I think would be to be a member of our Patient and Family Partnership Council. We meet monthly. I know we have a couple members on right now who could maybe speak a little bit to what we do, or at least they probably can't. They're probably muted, but I can. So we meet monthly. It's really an energizing group. It's one of my favorite meetings of the month where teams bring forward anything, really. They can be a process, it can be signage, it can be uh, layout of a lobby or facility type related. We have a lot of educational materials that are brought to our team to give feedback from a patient perspective. And it's really, really interesting because I think a lot of people, me included, will sit around a a conference room table, right? And we think we know what's right for our patients. And then we bring it to a group, and our patients just add valuable insight that can often completely change the direction of the educational materials or the processes. And our goal as a culture is to make sure people are bringing those projects early. I think we have a culture where we work and we do all this stuff, and then we bring it to our councils and we ask for approval. And my goal in evolving our culture is to get those projects before they've even really been formed, so that we're getting patients right in there in the mix of developing the process rather than just rubber stamping it. So Steve, if you're interested, I think Abby can get you my email address, and we can connect, and I'll get you connected with that group.
Thank you, both of you. And then Kathy had some kudos to provide. She said, my husband was treated at Frauenschuh Cancer Center a decade ago. From the first diagnostic appointment to his final breath, we both felt seen, heard, and cared for by Dr. Mark Wilkowski and all the attending staff day in and day out. It's thrilling to know how Park Nicollet / Health Partners is continuing to hone this remarkable service model. Thank you, thank you, thank you.
Oh,
It's really
that's
sweet.
amazing. Thank you. You know, a part of the reason why our team is more system oriented as well is that our patients experience us at all points in their care journey. So it isn't just hospital. That, I mean, that's the other thing. We never work in isolation. I mean, you go to your clinic, you may be admitted into the hospital, you may experience our emergency center. Your experience with us follows a continuum, and that goes from hospital to hospital too. At Methodist, we receive a lot of patients from Hutchinson, from Olivia, and we want that care experience to feel the same, regardless of what facility you're being seen in. So I'm grateful to hear that you and your husband had such a great experience in the clinics too.
Well, Jason, thank you again for your time, and thank you everyone for joining us today. Steve, I will get you and Jason all connected, but thank you everyone, and I hope you all have a beautiful weekend.